And so I'm Julene, and I'm the director of the Museum Education Division of NAEA, National Art Education Association. And this is purely out of curiosity, not a guilt thing at all. How many people are NAEA members? This is more of a curiosity out of who's hearing about us. Okay, cool. Well, we'd love for you to join, but we understand that finances are tight. How many people have been to an NAEA convention or pre-conference? Okay, not a lot of people. All right. Good to know too. Well, we're glad that we're meeting you where you are in our fun Zoom days. Want to mention that NAEA, the position that I hold, and Celeste and Mika, who's also on the call today, are volunteer positions. So it's volunteer leadership. There is a professional staff in Arlington, Virginia. They are awesome and they do a whole lot. As those of us who work in nonprofits understand, a small but mighty staff is often the norm. We have a relatively new executive director. He's been on he was on board a whole month before the pandemic hit, and he had to help make the decision to cancel the in-person convention in March. So his name is Mario Rosero, and he actually has not a whole background, but has worked in museum education in the past, in addition to working at the Kennedy Center and also in leading curriculum for the School District of Chicago, not just arts, but all curriculum. So he's got a really great wide-ranging experience, and very excited to have him at the helm. I want to turn things over to Celeste, who's at the Virginia Museum of Fine Arts. She is also the regional Southeast region representative elect. NAEA has 4 different regions. They're kind of weird geographic divisions of the country, but everybody falls into those, and then you can be a regional representative and help out with planning various things that we do with NAEA. So Celeste, I'll let you take it away. Thanks for
Hey,
helping out today.
sure. Thanks so much, Jolene. It's great to see everyone. Can everyone hear me okay? Yeah, okay, good. This topic kind of came to mind because we're at the museum. We are 22 days into reopening and have learned some things that's been good and learned some things that we can improve on. And I thought it might be helpful to just share some of that experience, but also just create a forum where questions can be asked, thoughts, ideas can be exchanged. And that's what's been really great for these peer-to-peer conversations. So definitely if you're interested in talking about topics that are of hand right now, I know we've recorded these sessions and those are available on our social media page. And next week we'll be talking about working with teens during the pandemic. So I do encourage you to check those out. This is also a space of encouragement and support. So really, as you have questions, don't be afraid to ask them. We're all here to help each other and lift each other up. So we're going to start actually with a quick poll, Jolene, if you could, just to get a sense of where your institution is in this process. So if you could just pick the answer that speaks most to you and also why you're here, what interested you in coming. I'll do that too. And I don't know how to do polls, Jolene. So okay, great. Okay, so about half of you are looking for some advice. Great to see that a third are interested to share. And for those that are screaming help, we are here. That's what we're here for. So that is great. So just to get started, seeing that most of you have questions and need advice, maybe that's a good place to start instead of me kind of giving an overall spiel of career and where we are, because I'm happy to jump in, and those third of us who've gone through it can maybe help answer those questions. So if someone's feeling brave to start with kind of their biggest burning question about how to do this, feel free to, I think because we're a pretty small group, you can unmute yourself and just go ahead and open the floor with that main question that you might have. Or there's so many, you don't know where to start.
Good question.
Lindsay.
I'm Lindsay.
Yes.
I'm at the Wadsworth Athenaeum in Hartford. Just broadly, like how have visitors been, what's the tone been when they come in for the first time?
So I'm happy to answer that. Again, we've been open for 22 days, and from hearing from my colleagues in visitor services, people are really thankful, actually, and happy to be back. Attendance, I would say, is better than we expected it to be. Kind of comparatively looking at last July, our attendance in the same time period was about 27,000 people. Right now we're at 15,000. So it's actually not too far off. We also have a major exhibition that opened at the same time we opened, Sunken Cities, which is an Egyptian exhibition. So naturally has a bigger pool in terms of interest. I will also say that our requirements for people are masks are required in the museum. We are a state institution, so we follow state guidelines set out by the governor. And there has really been no pushback on masks from our visitors. So that was probably one of the biggest concerns for us. And I think that's a big concern for everybody, I think, just talking with colleagues. So we really haven't had to enforce that as much as we thought we might have. So I think generally people are thankful to have the opportunity to come back to the museum. Yeah, Catherine?
How was the staff trained in preparation for reopening?
And again, I can speak to VMFA. Anybody else who's reopened and wants to jump in here too, feel free. So we started a internal staff committee pretty soon after we shut our doors, which was March 14th. And we called it the Be Well Committee because we have a great marketing team. So that was comprised of representation from across the museum, across departments and staffing position levels. And it was triple chaired, not just co-chaired. So by, again, cross representation across the museum. And HR really took the responsibility of sort of advisory to that committee. And then that committee had subcommittee groups that looked at each kind of safety protocols, cleaning protocols, communication protocols, and operations. And so that's how that was filtered through in terms of training and how the staff would be prepared for that reopening. And again, because we're a state agency, all of those protocols filtered through the Virginia Department of Health for those kind of training and precautions and protocols. So it was a lot of, again, Zoom instruction and on-site. And again, I can speak more to kind of what my team did. And for us as an education team, because all of our programming obviously was canceled, we followed kind of that protocol training in terms of just personal health and how we would come back to our offices. That's where we focused in on that kind of information for our team. Anyone else who has reopened, done something similar in terms of an internal committee structure, and who could speak to that?
Yes, at the Corning Museum of Glass, we formed a reopening team probably, within a week or two after shutting down. And it was a pretty large team with representation from across the museum. Kind of every department had at least one person on the team. We ended up with, I think, at least 4 sub-teams that focused on specific areas like social distancing, cleaning, safety, and there's a lot of overlap, obviously. And our studio, which teaches glassmaking, they had kind of their own sub-team because trying to re-implement glass classes, it is a whole other kettle of fish. So, they kind of had their own sub-team with how to do that safely. So we, in the beginning, it was really rocky because this is such a huge undertaking, right? There's so many things you have to consider and things were changing every day. So we were meeting twice a week and the sub teams are meeting at least once a week and just going from there. And by the end of it, it no longer seemed so massive. We had kind of gotten it under control. Mm-hmm. We were there. And we've done a lot of the same things the VMFA did as far as training and things. And we have, we're in New York State, so there are pretty strict mandates that we have to follow. And it's all regionally broken down. So it's, you have to keep a whole eye on what the whole state is doing and what the different regions are doing. And it's still pretty big, but we've been open for about the same amount of time as well. We opened, our official opening was July 1st. We had a couple days before that where we did soft openings where like staff could go walk through and test, the procedures and things like that. And it's been going really well. Also same mask mandate and everything, and not really much pushback on that at all. The comments we mostly get are people are thankful to have a like safe and clean like place to go that is prioritizing public safety. So, we've set strict attendance limits. We're encouraging online ticket purchasing as much as possible so we can control those numbers as much as possible and things like that. And sorry, it's about to storm here, so I'm getting darker and darker because we're about to have a major something. It's thundering and everything. So if I disappear, that's probably my power or internet went bye-bye. So yeah, that's really similar to what we've been doing. Really strict cleaning protocols with everything, limited space, marking off of the floor of where to stand, where lines forms, entrances, exits, relabeling, whole, signage campaign and things like that. And what we're hearing is it's working really well so far. We're continuing to adjust as we go, because when you're in the middle of it, of course this means this, but when your public comes, they don't know that. So we're adjusting to feedback and any glitches that have happened along the way. So.
Question for Celeste, both you and is it Miki?
Mika.
Mika.
I should put phonetics but next to my name when I'm in these. Sorry.
No worries. Did staff returning to the museums precede your opening to the general public? Because at the Nelson Atkins, we've gotten to a point where staff have returned on site. Most staff choose to continue working from home, but some staff are on site in preparation for that point in which we open to the public, which hasn't been determined yet.
Yes, in Corning, limited, this was all because of state protocols too. We had sort of a phase in that we wanted to do where, like some of our collection staff needed to be on campus before the rest of us to ready the galleries and things like that. So we had a kind of desired phased return of staff, which was prior to opening, and we had to get special permission from the state to do that, which was moderately successful. Like we kind of got half of what we wanted, so it worked out okay in the end. And then that gradually ramped up before opening day. We are still in the part where if you can work from home, you are supposed to be working from home. So only the only people on campus are the ones who are really needed. And if to make the place run. And if attendance increases or they need extra people, you know, we're sort of on we can volunteer to go in to help guest services staff some locations that are currently unstaffed or something like that. If we have the kind of reliable schedule that can do that. So it's sort of an all hands on deck. And yeah, some people were able to get special permission to phase in before the museum opened to the public.
Yeah,
Okay.
I mean, oh, so go ahead, Julie.
I was just going to jump in and say that at the Minneapolis Institute of Art, it was very much like, if you have to go in, if you absolutely have to go in, you can, but otherwise, if you can continue to work from home, please do so, because the less folks that are in the building keeps the people that have to be there safer.
And Julian, did you mention if is MIA open yet?
It is. It opened last Thursday, but I was laid off a few weeks before that, so I'm not involved. I haven't been there during the actual opening, so yeah.
Yeah, and I would just agree. So we're in the same boat. So we, again, we're encouraged to telework when possible, and if possible, we can come in. Again, like for my team, I have no expectations of bodies in the house, unless that's a preference or that you need to. And we are having there's a lot of flexibility, and I'm very thankful that I'm in a position where I can work from home. But I try to go in a couple times. We have several buildings on our campus, and I'm in a smaller building, not the main museum. But we've actually developed a schedule from our floor. So we've worked it out where we minimize, the number of people that are in the building or on that floor simultaneously, and kind of just talk with each other. If there's a change or a shift, we adapt to, again, lessen the amount of people that could be exposed. There's also a core, like our head of HR and CEO is a trained COVID case tracker. So we're also offering that as a volunteer opportunity in terms of training, again, through as a state agency. So I don't know how many people are taking them up on that yet, but that is something that is being offered. There's also, I think we've talked a lot about staff kind of coming back, but volunteers are another huge cohort for the museum. So I'm kind of throwing a question out, but also sharing how, if volunteers, if there's been discussion on your teams or in your institutions about if and when to bring volunteers back. I know volunteers do various things for our institutions. So like our largest group are our tour guides, who are not back for obvious reasons. And I think for the shop and other areas that use volunteers, it's very much a phased in approach. Again, only if they're comfortable. So kind of wondering, not just with staff coming back, but people's experience or conversations about volunteers.
So I can again talk about Corning. We have not brought any volunteers back. We're engaging them online in various, things, development and just get-togethers, but and I don't know what the timeline is on that. We've suspended public guided tours indefinitely at this point. I don't know when we'll bring those back. So yeah, our docents and volunteers are both groups are off for the foreseeable future. And yeah, we'll just kind of have to see how it goes. And we haven't, some would like to come back, I think. Some are comfortable not being back yet. So we're gonna see how it goes and see what's happening mode at the moment.
I can chime in as well if I'm not cutting anyone else off. My name's Heinel Epley. I'm at the Cleveland Museum of Art, so I joined a little bit late. I apologize, but we are not allowing volunteers into the building at all indefinitely. I think the priority is for staff to have full access before any volunteers, before we start phasing volunteers in. And right now we're in a similar situation to you all, where all staff who can work from home are being asked to do so. So I know this has been really disappointing for a lot of our volunteers, and as a result of that, we sent out a survey to our docents in particular, who are the most active and vocal volunteers that we have. And one of the helpful things that we determined from that is that what they're missing most is actually not service, but the learning, their own personal learning. Mm-hmm. And so we've determined that we can, easily do that virtually, and that there are lots of opportunities for that. To continue kind of virtual trainings and things. So interestingly enough, it's more about like the personal fulfillment that folks are missing, rather than the actual interaction with the public. But I will say one project that we've determined might be a helpful place for them, if they would still like to offer service, is to write visual descriptions of artworks for our museum website, which is something that we've been wanting to do for a long time. And we have this group of people who may be equipped and have lots of time to do that. So that's something that we're currently trying to develop training for, so that they can move into that service if they would like to.
Can I ask a related question about, it sounds like everybody is not having their volunteers come back yet. Our plan is that when we reopen, we will have some of our docents coming back as they are comfortable, like the ones that are comfortable coming back. Is anybody else having volunteers come back soon-ish? And when I say soon, I mean like a month from now. And just any thoughts on that?
I'll jump in with a vote against that. My folks who have been on these in the weeks past, my stance was and is, I don't want to create any situation where there's the possibility for somebody who is not getting paid to be there to get sick. And even if it is even an option, then some people are going to take it and some people might get sick because of that, and I don't feel comfortable with that at all. So it was mostly a personal comfort, ethical thing for me, and as far as I know, that's continuing, because I think we've got a lot of volunteers. Most museum volunteers are in an age bracket that makes them at risk automatically. And yeah.
Heinel, you're not allowing volunteers because of like liability, or like what is just policy, or did I miss that?
A lot of it is about the number of people that are in the building, and that we would like to prioritize visitors who want to access the building. The volunteers are welcome to request a free ticket to come in as a visitor, but we want to save those spots for people to visit the galleries, since we're not facilitating any actual programming. We're not doing any programming through the rest of 2020, at least. We're still not sure about the spring, but basically it's about trying to limit the amount of bodies in the building and to save those spots for people to navigate the galleries, rather than sit at a desk or, do something that maybe isn't a regular need anymore.
The conversation about volunteers just cues me into what I'm most interested in, and for all of the museums, it sounds like none of us have embarked on programming, and I'm curious for those those museums who have reopened, what's the thought and planning process towards reinstituting programming? And for many of programs, they're dependent on volunteers and dependent on docents. How are those considerations being factored in? Anyone starting to wrestle with that?
Yes. I feel like it's all I think about. So again, I think how we're approaching it is really based on audience need, and kind of their interest and feedback and what we can safely accommodate with protocols in place. And then again, as our guidelines from the governor dictate. So we actually just had a meeting. I was in a meeting today about some of our studio programs possibly restarting in the fall. Thinking about, again, because we can control the size of that, and really control that protocol, and safety, and ensuring our faculty have what they need to feel comfortable to do that work. So again, depending on the age ranges and kind of what the activity is, we are tentatively moving forward, with the caveat that that could change based on the week. So we have the wherewithal to cancel some of that means there will be kind of hybrid offerings. So again, depending on the size, it may be like on-site, and then move to like a virtual component. For our early childhood programs, for example, which are a child and a caregiver accompaniment, we will not be doing in person, probably until maybe October. So continuing to do virtual. For adults, we are going to offer, again, like very, very limited enrollment classes. Now, that's what could offer, but again, it may not fill it all and we may not run them. So we're doing a lot of survey and polling of past students to see what they would feel comfortable with in terms of engagement to help inform our decision as well. So I'm happy to share that, as we come up with those surveys, share that out. So that's kind of where we are in classes, which we feel the most comfortable with. Touring, we had postponed through mid-September, and we're kind of reassessing. I think for us, our biggest attendance for tours is schools. And in our area, just this week, schools are going virtual for at least the first 9 weeks. And one school going virtual, school district virtual all through the fall. And we're assuming that there will be no on-site touring or field trips really of any kind. So we're not sure where we're going to land in using our tour guides for that yet. And then our lecture programming, those are just not happening through the end of the year. So we'll be doing those virtual as well. I think I will say, as we had to cancel our summer offerings, people were very understanding. And I think we've seen a lot of, I know for our faculty and also our, students and participants, a lot of grace. And that's very thankful for that. And patience, as we navigate and make those decisions. So that's kind of where we are. I think we have a great support in our leadership that they, are like, whatever you feel comfortable doing. There's been no pressure to say you have to make revenue or you have to do this. They're really, again, leaning into what we feel like is the best decision. But I will say, like, I'm also really looking to them and thinking about and working with our state, again, as a state agency, to kind of those health protocols and helping inform those decisions as well.
I want to jump in with a question that was submitted. When leadership or those in higher positions are not setting good examples. So an example of one member of senior staff not wearing a mask when they're moving through public spaces, even though there are signs everywhere to do so. And other things happening, like a photo shoot where they're near you, but because it's a photo shoot, they're not wearing masks because, so, you've got rules in place, but then not everybody's following them. Sometimes people who have authority over you, that's a really tricky situation. So I am really sorry that you're having to go through that. But it's probably likely that others are dealing with something like that too. I might personally lean on the example for the public with the person who works there of, you know, oh yeah, it's really a drag, but we need, it'd be like if I went up and started touching things. I don't know. I don't know how to convince people of that.
Yeah, that's hard. Any other kind of thoughts on that, or you can
I have a follow-up question for you or everyone. So I know you're not really necessarily feeling pressure to earn revenue, but do your programs need to at least pay for themselves, or how is everyone's budget doing? So our budget for the whole next fiscal year is zero, basically. We're just trying to cover salaries and not lay staff members off. So they are being fair in that they're not requiring us to do certain programs because we don't have a budget to put them on, but kind of in a way saying if it can pay for itself, then we can do it. But so I don't know what other people's experiences, and our programs rarely ever pay for themselves because we try to keep them really low prices so we can have lots of different, you know, people attend with different economic whatever backgrounds, but yeah.
I'll just share with the group that for the most part, education budgets at the Nelson Atkins were almost completely minimized, if not zeroed out. Many of them were zeroed out this year, which, and I shared with Julian and Celeste when I first got on the call that I'm part of a task force who's looking at when and how we bring back programming and the priorities and protocols around that. And part of it feels a little like an exercise, just an exercise, because we don't yet know how we're going to pay for those programs. So the emphasis has been low to no cost. The emphasis has been hybrid, virtual, in person. Emphasis has been on experimentation and really sort of flexible things, leading to this point in the future that no one knows when it's going to happen, that we may be able to go back to something that resembled what we had before, but with complete uncertainty. And I don't know if that's kind of hitting a chord with other museums and others in the conversation today.
Kylie, I can chime in and also respond to what Adam's saying. I wouldn't say that our budgets were completely eliminated, but they were very heavily reduced, and in some cases, we will have to make some staffing reductions for sure in the next few weeks. But in terms of sustainability, I mentioned this in a previous peer-to-peer weekly, and some of you may have been there and some of you may have not, so I apologize if you've heard it already before, but something that we experimented with in the past 2 years is a kind of pay what you wish model, and that worked pretty well for us. That was prior to COVID, and I'm not sure whether some folks might be more likely to give because they know that the situation is very dire, or whether some folks might have, you know, less because they're more stretched. But I would encourage folks to consider that even if the program doesn't cost money for you to facilitate in terms of materials, the staffing is a cost and is a reality, and your building is a cost and is a reality. And so, you know, we've tried to kind of estimate, like, this is how much it costs for us to deliver this program to you, and we would just like you to know that. And if you are able to donate anything towards that, please do. And if not, we still want you to participate, but at least making it transparent and allowing those folks who do have the means to contribute towards it. Because I think the other big challenge is then there are assumptions that, like, this free programming is just, it doesn't cost you anything, who cares, whatever. So just being upfront about this is what it actually costs us to serve you, and we'd love for you to help us with that if you can, and if not, no worries, we're here.
And I would just add on to that, Heinold, that adding the option to gift or like buy one for somebody else who can't afford it is a really nice, simple, small way that people can feel like they're making a difference. They are, and then they're potentially covering the cost of somebody who can't pay.
And we have actually, I mean, we've had like a class from a Catholic school say like, we did this as like a class fundraiser. We wanted to help another class. And, you know, it's not $1 million, but it's a nice option. And in some cases, we've been surprised with how much has come in. You know, there are plenty of people that bring nothing, but there are lots of others that do donate more than we might have expected. And it's not always from where you think it is. So I think that is always interesting to watch too. It's not always the fanciest communities that are donating.
Any other kind of thinking about concerns or questions that you have as kind of you navigate a reopening, or people who have gone through it to share any kind of learnings that they have?
Yeah,
or
I was
advice?
curious. That's what I was
Yeah.
going to ask. Are there people who have opened already? I'm curious, like what's been surprising? What didn't you anticipate? Those are some of the key ones.
Yeah. Sorry, I'm pointing at you like you see me. Sorry.
No, I raised my hand like you could call on me. Hi, my name is Emily Wellborn. I haven't been here before, so it's great to meet all of you. I'm in the education department of the Watkins Museum in Lawrence, Kansas. So we're a much smaller organization. We've actually reopened twice because one of our staff members got sick and was in the building, and it was just safer to close down for 2 weeks and get everyone tested. And since we're a smaller staff, we were able to do so. And I'm more interested in learning from you all and then sharing what we did to reopen, because I'm wondering what, if you are looking at your reopening plans in terms of staff members getting it as an inevitability, and what you're doing and what you're planning to be proactive or reactive to that.
Sorry, I'm like, it's a really good question. So when we shut down, like the day after we shut down, one of our staff members tested positive, and we haven't had a case since. I think the protocols and the Be Well committee and making sure like the PPE is there for everybody. We don't want to assume that someone will get it. I think we're taking those precautions. And there's a plan in place, should there be a case with that contact tracing. Because there's so many buildings on our campus, I think that's going to come into play, and the telework, the encouragement of telework for people who can telework is really important in that respect as well. So I don't know if that even answered your question, but those are the key points I think for us as we look to operating.
It seems like that's a key point, just that any reopening plan needs to have is like, if this happens, and to Emily, what you're saying, kind of when it happens, like what is the protocol and how is the contact tracing happening and that kind of stuff. Yeah. That's a question, since thinking about contact tracing, if visitors are having to get a ticket in advance, I'm guessing for most places that's the case. So then you've got potentially contact information for visitors. Is that part of people's protocols that like if somebody is identified, that then you can contact all visitors at this as well?
I believe so. Not working on that end of things, I'm not entirely sure, but I know that they are making a big effort to collect that information on the non-online sales. I mean, yes, online we would get that information. And so yeah, they're primarily working from the standpoint of prevention. We're in a pretty rural area, so locally cases are not huge, but we get a lot of travelers from maybe some zip codes and places that are not being as cautious. And so that has put staff a little bit on edge, understandably. And so I think the emphasis is on prevention, and there are protocols in place. We have to, if we are going on campus, there's a questionnaire we have to answer every single time. They have the contact tracing protocols in place, and staff are also, you know, we're being asked to be, I guess, open about any travel that we do, you know, for those purposes as well. So they're working from prevention in the hope that no one gets it, but also they're being very proactive about, if you are exposed, you are home for 2 weeks, regardless, you know, not putting any, you know, so we have those protocols in place, and there's a plan for what happens if you're exposed, if you get it. And this is all of these policies have been put on our intranet so that staff can see them. They know what the expectations are. They know how it's being handled. And I don't have exact details for all of them because there are a lot of contingency plans and I can't memorize them all. But we have a safety manager who has certainly been earning his paycheck since March. I don't envy him. He knows probably more about state workings and all of this than he ever would have wanted to. But we have all of those in place so that there is a plan, and there's a, you know, contingency for it when, you know, a staff member were to get it.
I can also say that, and like Mika, I have not been in the building really. I went one time to visit my office, so I don't have a lot of interaction with the day-to-day. But from what I understand, visitors have been following the policies pretty well for the most part. And our state actually, just as of this afternoon, is moving into a mask mandate across the state. So technically, they can't go anywhere without a mask. There's some kind of technological feature that I do not understand enough about that can read the temperatures of folks who enter our lobby. I've only seen pictures of it, but it somehow does like a quick scan and it'll turn somebody's face, like put a red square around it if their temperature is higher than the threshold. I have no idea how many people have had to be turned away from that. I haven't heard much about that being an issue. The only issues that I've heard about are just people complaining about not wearing, or about wearing masks. But again, at this point, I think it is our state mandate as of today, so they wouldn't really have an option to be out in public without a mask.
I have a question. I don't know if it was brought up when I wasn't here, but how many, for those museums that are open, what is your visitorship? Is there interest, or, you know, I know there's probably limits to how many people you can have in your building, but have you had to use that, or like, are you full?
So I shared kind of attendance wise. So we've been open for 22 days and we're at 15,000 for those 22 days. And compared to the same time last year, we were about 27,000. So I think not bad. I think what we have learned, and again, adjusting based on experience and feedback from our visitor, is our special exhibition. So we decreased the capacity for each time ticket sale before we even opened to from what we were anticipating on doing. And it's an Egyptian exhibition, so we were expecting a lot of people. And after the first 4 days, decreased it even further based on the experience of visitors. There were a couple of spaces in the exhibition with that, even in planning for 6 feet apart still felt too close and too crowded. And that's where our visitor survey, and our great evaluation specialist, again, earning that paycheck, and proving data does matter, everybody. And listening to visitors does matter, everybody. So sorry, and I'm preaching to the choir, but that has been really helpful again, and changing protocol and changing capacity. So we're making it safer. So that will, I think, thereby decrease, obviously how many people we can serve with this exhibition, but that's fine. So it's been, I would say the exhibition has been doing well. The rest of our gallery, kind of the exhibition itself is about 8,000 of that 15,000. So I think it does say pretty evenly split between visitation of our permanent collection and the special exhibition. I will say also, this is a question for everybody who might have a campus or a sculpture garden. Just really interested to know how that has been used by the public. Our sculpture garden is accessible all the time. There's not a closed entry point or a fence or gate. It's very much a thoroughfare for the neighborhood. So even though our buildings were shut, people were still coming through the sculpture garden and using the garden, even when we were closed. And that's where I see more, there's not a requirement for wearing masks outside, but there have been moments where if I walked through, I'm like, do you know each, I don't say, do you know each other, but in your mind, you're like, do you know, so that's where I see much more kind of free-willing use. And again, because it does function almost like a public space, and again, based on the guidelines for the state, you actually don't need to wear a mask if you can be 6 feet apart outside. So just wondering if people that have sculpture gardens, what has that been like?
Celeste, the Nelson Atkins does have a sculpture park, and like the Virginia Museum of Fine Arts, it's not closable, so it has been kind of which has been nice because during closure, it's an access of it's a part of the museum that's accessible.
Yeah.
What's interesting, and I don't know if anyone else who does have a sculpture park has faced this as well, but where the museum has been where the Nelson Atkins has been incredibly cautious about its reopening. It set the September date really, really early on, almost right after we closed. And still there's question marks about whether we will open in September or not. One of the responses from the public we get is, well, why can't you start programming in the sculpture park where it's not indoors, there could be some kind of activity, some kind of engagement. And this is actually some responses that we've seen on social media from our audiences. And I don't know if anyone else has felt that pressure from audiences as well.
I guess I'm curious to hear, Adam, about what are the state guidelines in Missouri, or are there any? Because I think I've been hearing a lot of folks kind of using that as the excuse for
state guidelines are there. Our city municipal guidelines are more strict than our state guidelines, and the Nelson Atkins is private, so it doesn't have to. It has to follow the state guidelines, but we're actually even more cautious. So we don't have to be aligned with the state in terms of the minimums, or if the state says all state-supported institutions have to open, we don't have to follow those guidelines either.
The Wadsworth in Hartford, we did kind of amp up our outdoor. We have sculptures on the grounds, and we did increase interpretation, put up some new signage, and I don't know in terms of how popular it's been. It's a little hard to quantify, but that was an important decision kind of early on that we would commit to doing.
And I'm sorry, I was answering a question in the chat. Someone asked how I disseminated post-visit surveys at the museum, or the museum does. So we email ticket holders for exhibitions. Pre-COVID, we did intercept surveys. And I will say our evaluation staff has, I guess we tried that for sunken cities, and that's not working. So that was a lesson, you know. Again, we did that in a way, we thought, again, adhering to social distancing and masks and, you know, being very careful, but people are not. They're like, nope, and that's fine. So we are, yeah, listening and respecting that and switching tactics. And I think for programming wise, Adam, thinking about Sculpture Garden, I would say we're not getting inquiries to host programming in that space. We have thought about that. So when summer classes, we decide not to have those, we did think about like, well, we'll see where, you know, the city and the state is in terms of cases. And maybe we'll do like pop-up classes, you know, for families in the Sculpture Garden. Over the past few weeks, Virginia has started to, you know, creep up a little bit more. And our faculty and education team are like, you know, again, no one's beaten down the door. And I'd rather, if someone's not feeling like, if my team's not comfortable, then like, we're not ready to do that. I think like Lindsay was saying also, we've really looked at kind of how we have some interpretation of our land, kind of history in that space that's been up, but we're also looking at the works of art in the space and how we can build resources around that. And online resources where we put a lot of our energy in terms of development, you know, across the museum for that free access. So I think for us, that Sculpture Garden, again, is just sort of people coming and using it, you know, for what as they would normally when we're open.
I think it's nice that people like love your programming, and I would try and, you know, frame it that way and hopefully redirect to something else. But one thing that I know that has happened at other museums where I've worked is that a couple of posts on social media, there is immediate response to, oh, people want programming, we must do programming. It's like 2 people posted on an Instagram post. That does not mean that the world is clamoring for this. So it's good to be responsive to visitors or potential visitors, but it's also possible to be too reactive. And so I would see that as like a great indicator that people love what you have done in the past and like, let's redirect to this cool online option.
Sample size is very important. Yeah. Other surprises from folks that have opened, or what you wish you had done differently, maybe is another question. No. Any other burning questions on reopening that we haven't gotten to?
I have a question on programming, kind of about reopening.
Yeah.
Because we're moving so many things to digital, we're being asked, okay, how are you helping audiences that don't have access? And I just keep turning it around in my mind, like we can give them packets, but they still have to get to the place to get the packet. Like, does anybody have any good ideas on this front?
So yeah, a couple times through the pandemic, we did activity packs, and we connected with our local food bank, which was handing out meals through the schools or at the schools. So families who were coming to get meals could pick up packets as well. And we expanded that in the second go round of packets to a couple. We broadened our geographic area a little bit to community centers as well that were serving meals. That's an audience we don't reach normally, so this was, you know, an opportunity to expand in that way. So we distributed packets to community centers as well, who were handing out meals and knew that their families could come in and get them. So that's how we handled that. And I'm honestly hoping we can do more of that even as we reopen and do less digital, or as people are more comfortable, because yeah, that went well. We did develop a little postcard kind of survey that we stamped, so people with the second packet could kind of mail it back and we could get a little bit of data. Since we're not going in the office, I don't know how many we're getting back yet. I don't know how that's going, but we'll find out. So yeah.
That was going to be my question, is there a way for you to track how many people are actually using them, or their interest, or, you know?
We're hoping through the postcards. I know we've gotten a couple back. We're not going in frequently enough to, you know, check and see if we got a lot, but that was the one way we could, we're starting there, and just we can tweak, you know, and adjust the methods as we go if we get to do this again and try something different.
We set up a delivery service for some of our packets for our summer programming. I'm not sure how well that would work with a lot of your institutions, but if there were, there was a situation where we had demand that exceeded our capabilities, we have some really great community partners like our community foundations or other institutions that we could lean on them for also partnering with the programming to create more deliveries too. So that's worked for us really well in the past.
And we're going to do a back to school pack. So we're working closely with Richmond. Well, we'll help be going through Richmond Public School systems to distribute with their lunch and food distribution sites for back to school. So that's another great kind of a system that's already in place that, based on our, you know, past relationship and working together, can get those out.
I saw another, like, I think it's a little bit along those lines, but not for necessarily a underserved population, but a museum partnered with several restaurants. And so each of those restaurants basically had a coloring sheet, you know, for adults, for anybody, that went in with all of their takeout orders, which I thought was kind of,
that's cool.
It was kind of nice and clever, and a good way to keep you in front of people as you move forward. We are at time. I want to thank Celeste so much and everybody for participating, asking questions, sharing ideas and advice. We do these every week. I hope you'll join us. You can find out the topics on our Facebook page, which is NAEA Museum Ed. Just Google on Facebook, just Facebook on Facebook. I don't know. Anyway, hope everybody has a good rest of their day and a good weekend too.
Thanks everyone for your questions and ideas.
Thanks all.
Thank you.